very good morning and warm welcome to all our viewers. My name is Dipali Safaya and I welcome you all to We Talk to You, a show by Puberty to Menopause, a public health awareness initiative by Human Biological Institute. Puberty to Menopause is yet another initiative created by Human Biological Institute where we try to provide expert medical advice and create awareness on women's health. It's my pleasure to take this opportunity and share about Human Biological Institute. Human Biological Institute shaping global healthcare by spearheading the One Health initiative. Indian Immunological Limited was established by National Dairy Development Board NDDB 1982 as its unit and later registered as a company in 1999 with the name Indian Immunologicals Limited. Human Biological Institute was established in the year 1998 when the Government of India requested Indian Immunological Limited to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of Human Biological Institute was established at Ooty. This facility is one of its kind in India to have rolled out first Vero cell culture rabies vaccine in 2000. Subsequently, Human Biological Institute launched other vaccines and currently we are the major player in human vaccines. We are the leaders in anti-rabies vaccine segment and present in around 16 countries. We are three state-of-the-art manufacturing facilities at Ooty, Gachibowli, and Karkapatla, also known as Genome Valley. Human Biological Institute has forayed into the market of clinically proven wellness products and infertility ranges of hormones. Coming to our vision, mission, and values, our vision is shaping global healthcare by spearheading the One Health initiative. Our mission is to innovate, produce, and market quality healthcare products and services to improve and extend lives. We believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customers' need. As we know, we are the kind of company who will definitely look after taking care of the environment as we have launched our flagship brand anti-rabies vaccine Abhera, and with this we have taken significant step to reduce the plastic burden by 160 ton per annum. Well, coming to our corporate social responsibility, Human Biological Institute has done a lot in corporate social responsibility and has taken up various projects. One such project is adoption of government school, where Indian Immunological Limited has adopted two government schools in the vicinity of its Karkapatla facility in Hyderabad. Another is gift milk program in coordination with National Dairy Development Board. We are giving additional nutritional supplement to over 1,600 school-going children of Telangana and Tamil Nadu. We have also facilitated the setup of oxygen generation plant at Telangana Institute of Medical Sciences, Gachibowli. You can visit us on our website www.indimmune.com and can contact us on our toll-free number 1800-313-99977. You can follow us on all the social media platforms LinkedIn, YouTube, Facebook, Instagram, and Twitter. You can visit us, you can go through a unique initiative on fight against rabies at www.fearlessagainstrabies.com and everything want to know about the women health on www.pubertytomenopause.com. So once again, I welcome all our viewers who have joined us live today. Well, in today's show, we are going to talk about a very, very important topic, which is navigating infertility, coping strategies for working women. Well, a day is not far when the issue infertility is going to be as common as type 2 diabetes in India. It is so common, or I would say it is so rapidly increasing the cost in the stress for working women because of night shift, long working hours, additional stress. It is becoming very rapid and increasing at an alarming rate in women of India. Well, statistics says that one in six couple today face the problem of infertility and would like to go and visit infertility specialist for conceiving the hope of parenthood. Well, so to understand that, we have a very special guest with us today. Please welcome Dr. Priti Gupta. Well, we are honored to welcome Dr. Gupta with us today. a distinguished consultant in fertility and IVF expert at First Step IVF Center, New Delhi. With a profound commitment to the field of reproductive medicine and a wealth of experience, Dr. Gupta has played a pivotal role in helping countless individuals and couples realize their dreams of parenthood. We are eager to gain insights from doctor's expertise and learn about today's topic.
Hi everyone.
Hi, doctor.
Hi Dipali. Hi everyone.
A very warm welcome, doctor, and thank you for joining us today.
Thank you. It's a pleasure.
Doctor, without any further delay, I would like to request you to help our viewers know, and I know for sure that they know a bit about the word infertility, but it would be great to hear it from you to, give us some brief about that. What exactly is infertility, and why should everyone be aware of it?
Yes, it's very, very important for everybody to be aware because infertility is defined as that when you've been trying to have a baby by unprotected intercourse for 1 year and you've not have any conception, and this limit decreases to 6 months if you're more than 35. That if you're 35 and above and you've been trying for 6 months, if you haven't conceived, please, please visit your doctor and consult and don't delay it further.
Um, Doctor, as you mentioned that women of India, especially when we see the working women force, are at the increased risk of infertility. So, doctor, what could be the risk factors or problems that we see are cause of infertility, especially in women?
Dipali, it saddens me to see that people, the women of India, are really struggling. They are struggling to achieve a name for themselves. They are struggling to have their family. They're struggling with their families, their in-laws, and the pressure created by our society of having. And it's really stressful for them to manage all this. Having a baby is a very beautiful experience, Dipali, and I want everybody to have two children. Uh, so they should plan ahead, and the stresses are there, but we are all born in the land of Lakshmi and Parvati, and Indira Gandhi is there, and so many people, and we are actually so strong women. That is why God has made us, so we can manage everything. But if planned nicely, deal away with the stress nicely, and plan, consult your doctors. Okay.
Thank you so much, doctor. Doctor, not being able to fall pregnant or to get upset to deal with it. So when a particular couple comes to you and you see the issue, so by that time, doctor, also in that perspective, can you help us understand that what are the various fertility testing options which are available out there, including their success rate, risk, and what is the cost, most importantly, which is involved?
So we'll go step by step. First of all, we'll talk about the various causes. Now, the women out there should know that there are four very important factors which you should know. If they are all right, you should conceive in 85% of the times in 1 year. So every lady is born with a uterus, two fallopian tubes, and two ovaries. So there should be regular cycles. That means you are ovulating properly. You are forming, your ovaries should be healthy. The number of eggs should be good, then the fallopian tubes should be okay, and the uterus should be okay, and the sperm should be okay. So if these four factors are okay, the patient will definitely conceive. Now we see in India, because of the work pressures and everything, everybody is delaying. Career is taking a priority, and we are delaying our family life. The biological clock is ticking. So the after 35 years of age, the eggs decline sharply. The egg number and the egg quality decline sharply. So the possibility of you achieving pregnancy is less. Also, there are chances of increased miscarriage and genetic problems in the baby. So you all should aim to plan your pregnancy less than 35 years. So that's because the eggs quality declines. Then, and as I told you, there are other factors also which you should all know and accordingly understand. Because I got a couple who's married for 11 years, have not having regular side, and so far they are sitting, and now this girl has stopped her periods, so probably it is bad, so I may not be able to help them a lot, so please visit on time. So these are the various things that we should keep in mind. The second question was that what other treatments available. So treatments can vary from simple to complex. For example, these days you must have heard, everybody, that polycystic ovary,
Yes.
women are having long, they are not having proper sleep, and weight, they are having tobacco and alcohol intake, everything,
Yes.
and it's leading to a problem called polycystic ovary, in which the or the lady does not form eggs on time, and that is why she does not conceive. So a simple treatment as to giving in medications for making the eggs and telling them the right time helps in such cases. Then there can be problems like tubal blockages, so we have to do a surgery to know why the tubes are blocked and try to open them by something called as laparoscopy. Male factor is also increasing. We are having lot of cases where the sperm count is declining to such low levels that simple treatments are not possible. Then we come to a fact like intrauterine insemination or in vitro fertilization, which you all have heard. So then we are getting surprisingly young people, 23, 24, 28 years, wherein the egg reserve is so low that sometimes we have to take eggs from young girls from outside. And we take donor eggs and fertilize it with the husband's sperm and then put it inside the. So these options that
Uh, Hello? Hello, doctor? Hello?
hear you.
Your audio got stuck. Now it is
Yes,
fine.
I
Please, doctor.
hear you, Deepa. Yeah, yes. So these were the various
We had
causes and
lost.
treatments available.
Yes, please go ahead, doctor. Yes, we are able to hear you.
So we were talking about uh, fertility in working women. So what are the problems? As I told you, there's a physical stress, there's a mental stress, unable to sleep properly. All these stresses leads to abnormal imbalance in the hormones, female hormones, and because of this, lot of people have irregular cycles, and even by stress they have decreased sexual activity, decreased drives, they have increased fights with the husbands, and unable to understand, accommodate all these things. Because of this, the problem of infertility is really rising among these people. So there was a study in Korea wherein people working for women working for more than 52 hours a week, they said that the fertility rates are much less. And in India, it's not 52 hours, it's much more. They have 12-hour shift plus traveling and everything, leading to almost 72 to 80 hours, plus then on holidays they have the household work and all. So I don't know how these women manage, and it's leading to a lot of stresses and increasing problem in decreasing ability to conceive as well. Yeah.
Thank you,
So
doctor.
I
Yes,
think,
yes. Sorry. Please go ahead, doctor.
so I think it's time for women to understand, it's time for the employers, the government to understand, and it's time for the household people to understand, the husbands to understand and support their spouses, their daughter-in-laws, their employers, so that it leads to a healthy society. Because if the woman is healthy in the family, if the woman is happy in the family, then the family is happy. If the woman is unhappy, it leads to unhappy families, broken families. So I think through this platform, if anybody listening, even one person can understand, I will be very happy, and I feel I've done something today. Yeah.
Thank you, doctor. You said absolutely true about the stress and about the women. their happiness. It is actually very, very important in today's time. Doctor, also you have mentioned about the lifestyle factors as well. So, doctor, are there any lifestyle factors such as stress that might be contributing to infertility?
Yes, yes. So, as I said, long working hours leading to physical exhaustion, altered female hormones, decreased sexual drive, decreased time to have sex. The night shifts, the husband, I had a couple where the wife is having night shifts, morning shifts with the husband. It's so difficult. So these things, plus that leads to alcohol consumption, drugs, intake of drugs, smoking, which is again very, very bad. Then sitting long hours, they have backaches, and uh, they are gaining weight. They are eating unhealthy because they don't time to, they don't have cook healthy meals, and they are not taking regular meals. So all these problems, lack of sleep is there. I mean, how can one conceive in some circumstances? Even if they conceive, there are increased chances of miscarriage, and all these problems are rising alarmingly. It saddens me to see infertility being rising. There are a lot of patients with recurrent miscarriages and all. So lifestyle has a very, very, very important role. And the first thing any girl or lady walks to my clinic, I say, please forget everything, improve your lifestyle. If you have to lead a healthy life, a long life, if you have to see your family, your children getting married and everything, please, please, take care of your lifestyle, or eating habits, your exercise. Hardly any people can exercise, they don't have time to exercise, you know and I believe yoga is a very important thing. Please take out 15-20 minutes of your time to do some yoga, some meditation, despite your busy schedules.
True. Great, doctor. True. Thank you so much for answering this question. Doctor, also the trend of alcohol consumption today, drugs consumption today, eating junk food, sitting for long working hours, having unhealthy diet, as you mentioned. So, doctor, what can be the role of nutrition or exercise into the overall health of infertility, and what exactly the lifestyle change we have to? Yes.
So I'm telling you, if you improve your diet and start doing some exercise, half of your treatment is already done. Half the treatment, rather more than half of the treatment, is already done. I'll tell you about a patient who came to me. She was obese, and she was not. I was trying simple method. She had polycystic ovary. I tried giving her medication for making eggs, for doing IUI. Seeing things were not working, and then COVID came. And in those 2 years, this girl lost a lot of weight, and she conceived. Comes back to me in COVID, and she conceives. And she gives me a message ki, thank you, Dr. Preeti, for telling me and motivating me to lose weight. And that was the only treatment required. Nothing else was working. So we are also competing with God to so
Yes.
simple things like I'm so happy that people who follow this, females stop smoking, stop alcohol, even will males, Dipali, you will be surprised. I had a couple who came to me after 7 years of marriage, and I was planning, and I said, when I looked at the analysis of the male, and there were so many sperms, but all of them were dead. All of them were dead. So I thought I'd had to do IVF. But anyway, I said, you just take these medications and stop smoking and come back to me after 3 months. We'll see. So when he comes back to me after 3 months, and I see his report, and all the sperms are nice, I said, what have you done? It's amazing. So he says, Dr. Preeti, honestly, I haven't taken the medications, but I have stopped smoking. And I was amazed. And that couple said, Dr. Preeti, do my IVF now. It's too much. I said, no, you don't need IVF. They cycle IUI after 7 years, which was amazing. So simple leaving smoking can lead to so much improvement. It was miraculous almost. So these small, small things, if you do daily, take your almonds, take your milk, do exercise, take a lot of fruits, eat a lot of salads. It's not difficult. Believe me, this is very simple. I have been trying to do it myself. Eat 2 meals a day. Don't eat the time this McDonald's and KFCs and pizzas, they have ruined
Yes.
ruined. I'm telling you, the government, I feel somebody can hear and stop all this. Even our children are growing up in such an unhealthy environment, and this generation, the coming generation, will have much more problems of infertility, I can foresee right now. So I mean, those who are struggling, if you just do this, believe me, meditation, it helps you calm your mind, it decreases your anxiety levels and everything, which helps improve your mood, your stamina for working, everything. It's, you should all try and do these simple things, and I'm sure it's going to make a lot of difference in your lives.
True. Thank you so much, Doctor. Doctor, before we go to our next question, I would like to thanks everyone who has joined us live today in this program. And I would request you all, if you have any questions that you want Dr. Gupta to answer, you can please put it in the comment section or into the internal mail. So Doctor will answer all of them by the end of discussion. Well, now, Doctor, getting back to our discussion, in India now there's again an increasing trend, handling life with lot of stress, and it has become the integral part of the
Absolutely.
work these days. And also in India, especially with women, we have kind of learned to live with it. So, doctor, in that case, how can we balance the demand of our career with the demands of fertility treatment, such as scheduling doctor's appointment and again then managing stress?
Dipali, it's very difficult. I wish I could uh, go to higher authorities, go to banks, corporate people, and uh, tell them that, uh, again, as I told you, the women have to be healthy in the family for a healthy family. They have to be happy for a healthy family, and managing all this together is becoming tougher for them. So some places, people, women who have logged in and who are seeing, or who will ever see, and they have employees who are dealing with infertility, should consider and have a soft corner. You know, recently I had a girl, she said, my employer says, just, either go, because she has to take off from work to visit me, and it requires repeated, coming to my clinic from such far places. So he says, you just, I'll shun you out, I'll fire you. you know so I wish people could understand. That is one aspect. As far as what we can do as women is, I think the most important thing is to set our priorities. you know so career, I feel, should take a little back place, because at a time our biological clock is ticking. If we age, the chances of us becoming pregnant less. If we even conceive, the chances of miscarriage. So I think between 25 to 30, 32, we should, everybody should have, at least I feel, one baby, because although it seems like a big responsibility and your freedom is curtailed, but it's a beautiful experience, and this one can realize only when one becomes a mother. So I think one should prioritize what is important. And if you still feel, Dipali, that career is a priority, then you should have your eggs frozen. So these days we have, so there are two things very important. You should know your ovarian reserve. You should know how much eggs you are having. So on every birthday of yours, if you are delaying family planning or family, you should have or anti-mullary hormone done. I repeat, every birthday of yours, get your AMH test done, because this will tell us how many eggs are left. If they are decreasing, please get your eggs frozen in case you are not planning your family soon and you are more than 30, 32. Don't delay, because I'm getting couples who are in their 35, 36, and I have to do repeated IVFs because the number of eggs is so less, the quality is so less. Sometimes we have to think about donor IVF, also donor eggs. So you should know this. Through this medium of yours, Dipali, I want to tell everybody who's listening, please understand and get your eggs frozen in case, or set your priorities right. Have your family at the time. I tell everybody, see, if you are 30 and if you have a child at the age of 50, you know your child will be 20 years, he'll be settled, and then you can go for your career, or you can, do other course. Because having a child is a beautiful journey, which one realizes only when one has a child. You will not believe it, Dipali, but when I was 28 and I had a child, I was like, what is this? Where does this come from? And I was a doctor working for so many hours. It was so tough. I could not think of a second child. But when I had my second, I now feel that everybody should have two children. At the age of 28 and 34, Dipali, believe me, I did not realize that having two children, I thought it's too much. It's very difficult. It's very difficult. How will I be able to handle? But today, it's a blessing, and I wish everybody can have it.
Thank you, doctor. As you mentioned that the parenthood is a blessing, and
Yes.
also in another scenario, the biological clock is also ticking. So, doctor, in that context, again, I want to ask you is uh, that how long should a lady try for natural conception, before considering the fertility treatments,
Yeah.
and what are the typical time to see, okay, now it's time to seek for the medical assistance?
Okay. So, as I said right in the beginning, if you are less than 35 and it's been 1 year that you have been trying, you visit a doctor. If you are more than 35 and you've been trying for 6 months, right? Second thing is, if you're having irregular cycles, then you don't wait for a year. After 6 months only or early, you visit a doctor, because she'll give you a simple medication for making eggs and know the cause for your irregular periods. So if you are having severe other your pain during periods, these days we are seeing a lot of patients coming to us with endometriosis. So abortions you are having, we are having infections are also increasing in the females. So they have lot of some females come to us with a lot of pain during periods and pain in between. So if there are such symptoms and you've had multiple sexual partners, do consider visiting your doctor earlier to screen you from infections and other things. Yeah.
Thank you so much, doctor. Doctor, again, we see the success rate decline when the time the woman is going to reach 40. Almost, I would say, around, as per statistics, 13%. Then, what are the success rates of fertility treatments, and how many treatment cycle might be recommended, because before considering, okay, this is the option we have to go for?
Dipali, 40, no. In India, you will be surprised that we are aging 5, 6 years earlier than our Western counterparts. A lady, this success rate of 13, and it's valid for the European population or the American Caucasian population. For us, if we are 35, we are equivalent to a 41-year-old lady from Europe or US. So our success rates after 35, the eggs are declining. We are aging faster thanks to the pollution, thanks to the lifestyle that we are living, thanks to the food we are eating. We are aging earlier. So our success rates decline after 35. So in fact, you'll be surprised that at 40, I did IVF for six healthy females who had good eggs last year, and we just got one baby. Because rest of all, because as increases, as I told you, the number of eggs decline, the quality declines, the genetic problems increasing. So the chances of success rates would only be, say, 8 to 10% at 40. So the second question was that how many fertility. So I personally think we try 3 IUIs here. If it doesn't work, I think why it's not working. So go for something else like a laparoscopy, and then if it doesn't work, then we go for IVF. So that's a stepwise approach that I follow. Don't uh, IVF, 2 or 3 cycles can be tried, and I think if it does not work, I tell all my patients, and I myself feel, if something is not working, look for causes. Why is it not working? So if we are able to find the cause, we are able to give you the answer and give ourselves the answer of how can we improve the success rate with you. The third question was the cost. So
Yes.
one IVF cycle at our center costs around 1,50,000. It varies. Sometimes it's like 150 to 2 lakhs. A donor egg cycle costs around 2.5 to 3 lakhs. And a simple treatment like IUI costs around 8 to 10,000 a month. So I hope this answers the question that you put.
Yes, yes, doctor. Doctor, the next question I want to ask you is, we see essentially today the working women prioritize each and every work and balance home as well as the office. So what can be the typical timeline for fertility treatment from initial evaluation to potential conception? And how can, as a working woman, they have to plan this in their work life?
So as I told you that we have to prioritize, we have to see what are our priority. Is the baby or career our priority? So if we prioritize, we'll be more clearer in our mind. And if we freeze our eggs like Priyanka Chopra did, she did her freezing at 30 years and today she has a baby through surrogacy, although surrogacy is banned in India, so no longer an option for females. But yes, so my as a take as a woman myself, as a mother myself, as a doctor myself, I would tell everybody to plan your pregnancy earlier. Career can take a backseat. I know you, we all have worked very hard, and it's very sad when at career places we take a backseat and boys go ahead. But it's okay, let them go ahead, because at the age of 70, 80, it would not matter. That time what would matter is that you have beautiful children. They may be fighting or whatever, but you've had beautiful children, you've given them a good life, and then your career can go a little late. It's all right, it does not matter. So this the prioritizing is very very important, because that will bring. Now, otherwise you think, when will I become pregnant, when will it happen, when will I have a baby, first let my career second. It is not going to help. Just learn to meditate, prioritize, maintain a healthy lifestyle, eat healthy, and do some exercise. Sure, things will settle down.
Hello. Yes, thank you so much, doctor, for answering all the questions. It was a very wonderful session. Doctor,
And then,
it's time that we take some questions from the audience as well. I have received a few questions internally. Am I audible, doctor? Hello? Hello? Doctor has lost the connection in between. Yes, doctor.
yes, Dipali.
Yes, we had lost your connection in between. Well, doctor, it's time that we take few questions from the audience. I have received questions via internally. So the first question I have received is that the person is asking, doctor, what is the importance of regular gynecological checkups for working women concerned about fertility?
Okay. So, yeah, that's very important. As I told you earlier, also, uh, for women who are concerned and delaying one test every birthday, every year, you should get to know about the number of eggs. So, AMH. AMH, the normal AMH is between 1.5 to 5. If you have an abnormal AMH, please visit your doctor. That will tell us about the number of eggs. If you are more than 35 and you are still concerned, please visit your doctor ASAP, because you know it's high time, and don't delay it, because at the age of 38 the success rate becomes much less. Whatever we do, we are not god, we cannot change the quality of eggs, we can't change the number of eggs. There are experiments going on to for the eggs, but still we are not at par. I can't give you good eggs at 40 years, 38 years, 35 years. I have to keep my chances, try and keep trying, doing something or the other. So please, every year after 30 specifically, you should get your AMH done. So that's very important. And besides that, if you have any infections, any pain, any irregular cycles, that's the time to again consult your doctor. There is one test in India which we should all be aware of, and that is screening for cervical cancer. Whether it's fertility or not fertility, you should have a pap smear done every 3 years till the age of 55 years. And you can think about the cervical cancer vaccine as well. That's another thing. Besides this, uh, again, whether or not fertility is a concern, you should be healthy. So you should get your hemoglobin tested. You should not be anemic. Vitamin D deficiency is very common in India. Please get it checked so that you can take regular vitamin D shots. Besides, anybody who's planning to conceive, rather, I would suggest that before marriage there are two very very important tests that needs to be done. One is screening for thalassemia. What is thalassemia? Is a disorder in hemoglobin gene of your, because what is the importance? If you have thalassemia minor, so you should get your partner screened for the same test, because if both of you are carriers of that gene, the baby can have thalassemia major, which requires regular blood transfusion, and it's not good. So before marriage you should check your thalassemia. The other very important test which I consider is rubella infection testing, rubella IgG. I hope you must now, everybody should know about the antibodies. We all learned about during the COVID that COVID antibodies were high, low vaccination. So similarly, infection, you should get your antibodies checked. If the antibodies are high, that means you have been exposed to this infection. And in pregnancy, this will not cause any problem, because if rubella happens in pregnancy, the mother does not have any problem. She just has fever, cold, cough. But the baby can have a major, major malformations which can be preventable by doing rubella IgG before you are planning pregnancy. Anybody, or the third important, the next important thing I would say is to take your prenatal vitamins before you are planning pregnancy. You should take folic acid supplements because they help prevent certain brain defects in the baby. I hope I've answered all your questions.
Yes, doctor, you have answered it very briefly. Thank you so much. Doctor, the next question we have received is impact of excess weight on hormonal imbalance and how this relates to infertility.
Yes, excess weight is a very common problem these days. As I told you, thanks to the lifestyle that we are leading, everybody of us eating all junk food and maggies and all this, they lead to way imbalance in the hormones, because of which we are having a lot of polycystic ovary in our every third girl that's walking to my clinic. Every third, or I think I would say second or third girl, is having irregular periods, is having polycystic ovary, because of which there is increased hair growth on the face. We have seen a lot of people with increased hair growth and acne problem. Besides this, leading to low self esteem, depression. All these problems are bystanders. Depression and low self esteem, not having confidence. These are besides fertility, because then it's difficult conceiving also, it takes long. Then once you conceive, there are diabetes. Young patients are coming to me with diabetes
Yes.
because of excessive weight. It is very sad. Diabetes and high blood pressure, as a result, even if you conceive with difficulty, the pregnancy becomes very very complicated, and increased cesarean section rates, diabetes, having babies with the even neural tube defects in obese women, having increased miscarriages. So the as I told you, one problem is weight. Lifestyle, if you are able to manage this, half your problems are gone, half your visits are cut down to a doctor. So please manage that. Okay.
Thank thank you so much, doctor, for answering this question. Another audience question we have, doctor, obesity impact male infertility. What steps should I take to for the overweight men to improve their chance of conception?
Okay. obesity in men is also leading to hormonal imbalance. So what happens? The testosterone level decline. Hormone, female hormone. Testosterone is a male hormone. Male hormone decreases. And it drive, as I told you, depression, loss of confidence, all these things. So I mean, Dipali, that also lead in erection. They have erectile dysfunction. They are not able to have sex, normal sex, because of which there are fights and divorces and infertility. So again, the crux of the problem is weight. If we are able to manage it, again, how will we manage? I think we all know, Dipali, about the weight. We need to have a healthy lifestyle. I think half the answer to infertility is lifestyle. So for males and females, it's equally effective. It affects our hormones and everything, as I told you. So if you're able to manage our lifestyle, the weight, exercise, good diet, leaving junk food, again and again stressing all these factors, I hope even one person understands, it'll make my day.
Thank you so much, Doctor, for answering all the audience questions. Doctor, before we end this session, I would request you that kindly give a message to the couples, who are struggling with infertility, or a message for their journey to parenthood.
Okay. So I've already spoken about lot about lifestyle and healthy things. As far as the couples these days, what I have learned, Dipali, from all my years of practice is where a couple is walking together and they are supporting each other in this difficult journey. I have seen miracles happening where the couple is fighting, blaming each other for difficult problems. You are the cause, you are the cause. This, they are fighting. Things don't work out.
True.
So at the end, I realized a positive. There were couples, Dipali, wherein things seemed that nothing could work. And he said, "Ma'am, please try. We are there. At least you try. Why are you giving up?" And we could see miracles happening. A positive mindset, a hand holding for both the couples. I tell all the husbands, please, please support your wives in this difficult journey. That is going to make a difference. I hope some couples, some men could understand, could learn. And that is one very important thing. Positive mind, besides a healthy life, besides exercise, good nutrition. This is the message I would like to give, that uh, you know will help you in this beautiful journey of parenthood and difficult journey of infertility.
Thank you so much, Doctor, for answering, for giving us the key message for today.
Thank
And
you.
also, it was a very wonderful session, Doctor. We wholeheartedly thank you, Doctor, on behalf of my team as well as Human Biological Institute for sparing your most valuable time with us. And
Thank
I
you so much.
know, thank you, Doctor, once again. And I know a lot of people who are watching us are benefited from this wonderful session. I wholeheartedly thank our viewers as well for being with us in each and every session. Well, you can follow us on Instagram, Facebook, LinkedIn, and Twitter to get more updates on health and life talks with expert doctors across the nation. With that, I wish everyone again a very good morning. And thank you so much, Doctor. Thank you.
Thank you. It's an honor and pleasure. Have a very good day, all of you. Thank you.
Thank you.